Let's start with the normal sinus rhythm, which is the baseline rhythm most people have. A normal sinus rhythm is characterized by consistent RR intervals, a heart rate of 60 to 100 beats per minute, a P wave before every QRS complex, and a consistent PR interval of 0.12 to 0.2 seconds. Sinus arrhythmia is a normal variation in the heart rhythm, where the heart beats faster when breathing in, and slower when breathing out. It's common in healthy people and usually benign. In sinus arrhythmia, the ECG shows the normal PQRST pattern, but you'll notice irregular RR intervals due to respiration. In sinus bradycardia, the heart beats slower than normal, below 60 beats per minute, with normal sinus rhythm. And in sinus tachycardia, the heart beats faster than normal, more than 100 beats per minute, also with normal sinus rhythm. Premature atrial contraction is an extra heartbeat caused by the atria. It's common and usually benign. In the ECG, it's characterized by an early P wave, often followed by a QRS complex. Extra heartbeats can also originate in the ventricles of the heart. Isolated premature ventricular contractions are common among healthy people and usually not dangerous. In the ECG, they show up as a wide QRS complex. The preceding P wave is usually missing. In first-degree AV block, the conduction through the AV node is slower than usual, resulting in a prolonged PR interval. It's usually asymptomatic and doesn't require treatment, but monitoring may be necessary to check for progression to more severe types of heart blocks. Paroxysmal supraventricular tachycardia is characterized by a fast heartbeat with sudden onset and sudden termination, which originates in the atria. In the ECG, it shows a regular heart rate of 150 to 220 beats per minute and narrow QRS complexes. P waves are often missing. In atrial fibrillation, the atria beat rapidly and irregularly, out of sync with the ventricles. It may occur in temporary episodes or it may persist. In itself, it is not life-threatening, but it increases the risk of more serious medical conditions. In an ECG, the spacing between QRS complexes is irregular, the baseline is chaotic, and P waves are absent. In ventricular fibrillation, the heart's ventricles beat rapidly and randomly. This is a dangerous heart rhythm and needs immediate medical attention. The ECG shows chaotic fibrillatory waves and no distinct features of the sinus rhythm.